I'm going to be demonstrating putting in a nasogastric tube. So I'm going to go ahead and check my doctor's orders, check the size, what it's going to be used for and everything. That way I can tell everything to the patient. So checked it, there's no allergies, and it's going to be placed in there for suction. So I'm going to knock. Hi, my name's Erin. I'm going to be your nurse today. Can you tell me your name and your date of birth? Okay, Mr. Smith. Now, the doctor's ordered a nasogastric tube. It's a small tube. It's going to go in through one of your nostrils and go down into your stomach, and it's going to suction out all the contents in there. Is that going to be okay with you? Yes, that's fine. All right, so first what I'm going to do is check your nares. I'm going to see that they're straight, no deviations, and I'm going to check patency. So can you sniff for me? All right, and the other one. Okay, so I'm going to go ahead and use your left side. It looks like it's more straight and more patent. So I'm going to check and see how long I need to put this in. So I'm going to measure from your nose to behind your ear and down to your xiphoid process. So it's going to be about right here. I'm going to go ahead and put a little piece of tape on there. I'm going to have that measured out. Okay. And I'm going to do my hand hygiene, put my gloves on, and I'm going to loop the first 4 inches of the tube up. Now this procedure shouldn't hurt, and but you might feel a little bit nauseated, so I'm going to put this emesis base in here in case you get sick, okay? Alright, so I'm going to push your head back, and the patient's in high Fowler's. I'm going to start inserting. And I'm going to use my pen light to make sure that there's no coiling in the back of the throat. And I don't see any coiling. So at this time, I'm going to have you lean your head forward and take small sips of water while I continue to advance. So I heard the swishing in his stomach, and according to hospital protocol, I need an x-ray to verify the placement of the tube. So I'd go over my 4 P's before I left him. So he doesn't have to potty, he has no pain. All of his possessions are close by, and his position is comfortable. Okay. So I'd come back. X-ray confirms that the placement is correct. I would do my permanent taping on him, and I'm also going to pin this to your gown. That way there's no pulling of it. And I'm going to give you some slack, that way you can move your head still. And then I'm going to connect you back to suction, and I'll be back in a few minutes to check on you, okay? Cut it. So I am going to check and see if the patient has to potty. Make sure he's not in any pain, make sure his position's comfortable, and make sure all the possessions are within reach. Also going to make sure that you have your call bell in case you need it. Then I would go and I would document. I'm going to document the time, the tube length, the size and type of the tube, and the consistency and the drainage, and then the pH, and also the patient's response to the procedure. Okay, so now I'm going to do the irrigation of the NG tube. I'm going to check the patient's name and date of birth against his armband. Okay, can you tell me your name and your date of birth? Alrighty. So I am going to aspirate some of the client's gastric contents after I wash my hands, put my gloves on, and I disconnect it from the suction. And I'm going to place it on the towel. So I'm going to aspirate. I'm going to listen again for the swishing sounds. concentric swishing in the epigastric region. So that verifies my tube placement again. And so I'm going to disconnect, and I'm going to put in 30 milliliters of normal saline. So I'm going to insert, and then I'm going to take it back out. And I'm going to discard it. Going to turn this back onto the suction at the same rate that the doctor had prescribed. And I'm going to go back over my 4 Ps. So, do you have to potty? Is your position comfortable? Are you in any pain? And all your personal belongings are still in here with you. So then I'm going to go ahead and leave my patient. And I'm going to document the type and amount of the solution that was inserted, the difference of the volume instilled and withdrawn, the characteristics of the returned solution, and the client's response to the procedure. And that completes my irrigation process. Hi, my name is Erin. I am going to be showing you how to do the IV insertion. First, I am going to check my MAR and see what the doctor's ordered. So the doctor ordered an IV insertion for fluids and medication. So for fluids and medication, I use a 20 gauge. If it were for blood products, I'd be using an 18. So I am going to go ahead and go in and tell my patient what's going to happen after I prep everything. First I have my syringe, and I'm going to put my blunt cannula on it. And I'm going to clean off the bottle, aspirate, insert, pull back, make sure there's no air bubbles, which I don't see. Take that out, and I'm going to prep my extension tubing. So I'll lock this on, and when I prep my extension tubing, I'm going to unclamp it and make sure that there is fluid all the way through and no air bubbles. So I'm going to clamp it while still holding pressure on it, and I'm going to go ahead and put this back in here to make sure it stays sterile. So next I'm going to go into my patient's room, make sure I take my MAR with me and double check it again. So I am still going to be using the 20 gauge for the fluids, and check my patient's name. So, hi, my name is Erin. I'm going to be your nurse. Can you tell me your name and date of birth? Okay, great. So what I'm going to be doing is putting an IV in you and starting that. The doctor wants to put IV fluids and medication in you. Is that all right with you? Yes? Okay, great. Now, I want to check for the arm. I want to make sure that he hasn't had any shunts, fistulas, dialysis, or a mastectomy on this side, which he all said that he hadn't. So I'm going to go ahead and pick a nice bouncy vein. So I'm going to choose this one. And I'm going to start by applying my tourniquet. And when I apply my tourniquet, I want to make sure that it's not too tight. So I'm going to go ahead and check his radial pulse after it's on there. Okay. And I still feel the pulse, so that means he's still getting blood to that arm. I'm going to go ahead and wash my hands, put my gloves on, and I'm going to sterilize the field. So that's where I'm going to insert it. So I'm going to get my needle ready. I'm going to make sure that it's bevel up. I'm going to pull the skin taut, and I'm going to insert at a 15 degree. You see my flashback, so I'm going to lower it to a 10 and slide the rest of my cannula in. I'm going to put pressure there, discard my needle in the shrimps container, and pop my tourniquet. So attach my little extension tubing, undo the lock on it, aspirate for a blood return, and push some more fluid in there. And lock it while I still have my thumb on the plunger. And then I'm going to undo this. Okay. And hold this down. And I'm going to put my Tegaderm over it. And I'm going to put my initials, the date, the gauge, and make sure my patient is fine. Make sure it didn't hurt too bad. And check my 4 P's. Do you have to potty? Do you have all your personal belongings? Are you in any pain? And is your position okay? So he said that all of that was fine, so I'm going to leave him with his call bell, and I'm going to go and document. When I document, I want to put my date, time, the gauge of my catheter, the size, the length. Hi, my name's Erin. I am going to be doing medications through a mini bag. I'm going to compare my MAR first, and the doctor ordered Rocephin, 1,000 milligrams, every 12 hours. Rocephin is an antibiotic for infection, so that's why our patient will be receiving it. I have Rocephin here, and it's 500 milligrams per milliliter, and the doctor ordered 1,000, so it's going to be 2 milliliters of Rocephin. I'm going to go ahead and prep my saline syringe. I'm going to check the expiration date on it, and that's good, so I'm going to go ahead and clean off the top of it. And I'm going to aspirate 6 milliliters. And I'm going to check the expiration date on the Rocephin. Clean the top off. I'm going to do 2 milliliters. So now that I have my medications drawn, I am going to clean off the port to my normal saline that I'm going to add my Rocephin to. And I'm going to check the expiration date on it, which is so good. I would discard this in the Sharps container, and I'm going to gently mix my medications. Okay, so now that I have my medications mixed, I'm going to connect it to my tubing. Mix my medicine together, and I would go ahead and put a label on the back of it with my name, date, time, dose, medications, and my initials. So I'm going to go ahead and label the tubing as well. I'm going to put my name, date, and time on it because it's going to be reused, and that way we know how long the tubing's been up there. I'm going to spike my bag, and I'm going to fill it halfway. So there's halfway, and everything is clamped on it. So now I'm going to, I primed my drip chamber and made sure it was locked. Now I'm going to take my MAR, my medication, and my saline syringe, and I made sure that that tubing was clamped. So I'm going to go ahead and prime the tubing, which so my tubing is primed. I want to make sure that it's the drop factor is set on it. Actually, I'm going to do that in my patient's room, that way. And I'm going to reclamp it. So now I'm going to take my MAR, my saline syringe, and my medicine into the patient's room. So, hi, my name is Erin. I'm going to be your nurse today. The doctor's ordered Rocephin for your infection. Can you give me your name and date of birth? All right, so that matches up. So now, since I identified the patient, I'm going to do my hand hygiene, wash my hands, put my gloves on, make sure he's not allergic to the medication, and make sure that he is okay with me giving him the medication at this time. Then I'm going to check the site, make sure that there's no infiltration, any phlebitis, any signs of infection that might be going on. And I'm going to clean the port with my alcohol wipe. I'm going to start my ASASH. So I would unclamp this, connect my saline, aspirate, get some blood return, and I'm going to go ahead and administer 3 mLs of solation and clamp it with positive pressure. Okay. So now I am going to connect the medication after I clean the port again. Okay, so I'm setting my drop factor to 17, which is what I calculated earlier. And I already mentioned to the patient that this was going to be Rocephin for his infection that he had. And that some of the signs and symptoms would be nausea and vomiting. So I have it at 17 drops per minute. And I'm checking to make sure that there's no infiltrates and there's no phlebitis going on right now. I'm going to be back periodically, but this should be done in about 30 minutes. And when I come back in, I'm going to check that again. And do you have any pain right now? Okay, no pain. Do you have to potty? Is your position okay? And you have all your belongings next to you. And here's your call bell in case you do feel any of those signs and symptoms. So I'm going to take off my gloves, wash my hands, and go outside. And then 30 minutes later, or periodically, I'm going to check on him. And then 30 minutes later, I'm going to come back in, wash my hands, put on my gloves, check his site for any infiltration, any phlebitis going on, and the site looks fine. So I'm going to go ahead and disconnect, apply the clamp. and I have this clamped off. And I would reattach a needleless device because this tubing is good for his next dose of antibiotics. So now I'm going to go ahead and clean the port off. I'm going to attach my normal saline. I'm going to use my push-pause method. After I aspirate, get a plug return, push pause, push pause, push pause. Unattach that, and clean off the port again. And if this were a central line or a PICC line, I would be giving heparin, or if the hospital decided that it would be pertinent to this patient, he would get heparin as well. So now that everything's cleaned up, I would check my 4 P's again: pain, position, possessions, and potty. There's no... Okay, so when I document on my MAR about the MedVia mini bag, I would put the time, drug, dose, route, condition of IV site, the amount of fluids that I would use to deliver the medication in the mini bag, and how the patient tolerated it, and any information that I would have given the patient about the medication. I'm going to be showing how to hook up medication through a piggyback. I had my doctor's order. He ordered 1 milligram of Rocephin every 12 hours. It's an antibiotic for infection, and it's available in 500 milligrams per milliliter. The expiration date is still good, so I'm going to go ahead and give my patient 2 milligrams in the sodium chloride mini bag. So first I am going to clean off my bottle, and I check the expiration date on it. And I'm going to draw up 2 milliliters of air. Got 2 milliliters of Rocephin. Okay, I'm going to insert it in my bag. Throw this away into the sharps container. Mix my bag of meds up. Then I'm going to go ahead and put a label on this. I am going to put the medication, the dose, the date, the time, my initials, and the patient's name. And I'm going to label my tube with my name, the date, and time. That way any nurse coming up behind me would know when the tubing was put into place. So now that I have all this, I'm going to go into my patient's room and explain what I'm going to do. So, hi, my name is Erin. I'm going to be your nurse today. Can you tell me your name and your date of birth? Okay, Mr. Smith. Thank you. And the doctor ordered Rocephin. I'm going to go ahead and hook that up to the IV we already have running for you. Have you ever had Rocephin before? No? Okay, well, it's an antibiotic to treat your infection. It's going to take 30 minutes to go in, and the side effects are nausea, vomiting, colitis, which is upset tummy, and some seizures. So if you get any of that, let me know. I have my gloves on, and I did my hand hygiene when I came in. Let me know if any of that happens. I'm going to go ahead and hook this up. Is that alright? Okay, great. So I'm going to hook up my bag to my tubing. I'm going to prime my drip chamber to about halfway full. I'm going to hook it up. Prime my line. Make sure it's all no air bubbles. Looks good. I'm going to go ahead and drop down my main bag that's running. Up, and then I'm going to clean off the ports, make sure that's clean. So I'm going to go ahead and make sure that there was no infiltration, no tenderness at the site. I'm going to make sure he has his call bell, make sure he's not in any pain, doesn't have to go potty, has all his possessions, and his position's okay. So I'm going to come back in and check on you periodically. Give me a call on the call bell if you feel any of those signs and symptoms that we were talking about. And I will be back in 30 minutes to disconnect your bag, okay? So 30 minutes has passed. The bag has drained all the way out. I'm going to identify my patient after I did my hand hygiene and put my gloves on. Alright, so I'm going to disconnect your bag. It's all done. So I'm going to put my lock in place and disconnect my tubing. Put a new alligator clamp on it so that it stays sterile and it can be used for his next dose of Rocephin. And I am going to hang my main bag back up and make sure that it's set at the same drip factor that it was before, as the doctor ordered. Alright, so then I would check my patient's side again for any signs of phlebitis, any inflammation, any pain. Go over my 4 P's again with him: pain, potty, position, and possessions. Make sure the whole area is clean and he has his call bell in reach. And I would go ahead and leave the room and start to document. So when I document for this, I want to document on the MAR the time, the date, my initials, or my name actually, the dose, the route, the condition of the IV site, that there wasn't any redness, any infiltration, and the amount of fluid volume that I put in. And that completes my piggyback.